So we're going to segue from strain to looking at the parametric imaging. And it's based on the same type of principle. Okay, so you must have seen apical four-chamber views, probably short axis view of the heart, and there are colors all over the place. But there's a method to the madness, just like when we do color flow Doppler, certain principles are followed. And it's the same, basically the same principle. So if there's movement towards the probe, you're going to get a red color or different shades of red. If there's movement away from the probe, you're going to get blue or different shades of blue. The difference is that if you have strain is usually color coded in cyan to blue for lengthening. So you can have strain where you have lengthening, or you can have strain where you have shortening. If you have shortening, say the longitudinal strain, then it's going to be yellow to orange. Okay, and if there is no deformation, that means there is no lengthening, no shortening, then it's going to be green. So, you know, that's when we talk about parametric image, that's what we're talking about. And so this, this is a four-chamber view, and their color there. So again, as we said, the red means that the segment is moving towards the probe, and then the blue means it's moving away from the probe. Okay, so and then we talk about what cyan is, and then yellow. Okay, this is what we're talking about. This is a polar plot, and all of you guys are familiar with the polar plot, where we put all the segments together. So this in the center is the apical cap. Just outside of that, we have the apex. Just outside of that, the base of the heart. The mid segment of the heart. And just outside of that is the base. And remember that apart from the apex is divided into 4 segments or 4 regions. The mid cavity into 6 regions or segments, and then the base into 6 segments or region. So the apical cap is right here. The apex is there. You know, the anterior wall is up here. The inferior wall is right there. This is the septum right there, and then this is the lateral wall. Okay. Then at the mid-cavity level, where you have six segments, this is the anterior wall. The inferior wall is right there. This is all of this is your septum, but this is the anterior septum, inferior septum. Then this is the lateral wall. This is the inferior lateral wall, anterior lateral wall. And then at the base, you have your 6 segments as well. The anterior wall, the inferior wall. Over here is the lateral, anterior lateral, inferior lateral. Then this is the septum, inferior septum, anterior septum. Again, it's color coded, so you can see they're bright red, and there is pink and even lighter pink. And there's a number there. All right, so let's analyze and see what's happening here. So we have the apex. You can see this is minus 16. So it's a little bit abnormal. We said the normal strain is minus 18 to minus 24. this area is pink. So it's even though the whole segment is minus 16, there's a little portion that is the strain is a bit more abnormal then, okay? And then down here you have minus 15, which is borderline abnormal. And then when you get to the mid cavity level, this apex is minus 16, which, you know, it's red, so it's probably normal. The anterior lateral is minus 20, that's normal. But, you know, a little portion of it is pink, so you know that's abnormal. The inferior lateral wall minus 21, so most of it is normal, but there's a little pink area. And then the inferior wall minus 18, which is normal, but there's a little area which is abnormal because it's pink. Remember, red is normal. And then the inferior, sorry, the inferior septum minus 15, which is a little bit abnormal, okay? You can see this segment, sorry, this portion of the segment and that, but you know, probably most of it is normal. Then the anterior septum minus 14, definitely abnormal, and you can see it's pink. So not only you get a number, but it's so even if you don't see the number clearly, you can see the color. And again, bright red is normal, pink is abnormal. And then when you get to the base, the anterior wall, you know, pink and even lighter pink, you know, this is minus 10. So this is very abnormal. Okay. And so you can go to the different segments and just looking at the bullseye, the polar plot, you can determine whether it's normal or abnormal. So in this scenario, the abnormal is minus 15 to minus 25. So, you know, it will vary, you know, probably from minus 15 to minus 25. But definitely you want to see your strain, you know, closer to minus 20. All right. So what are some of the clinical utility of strain? How are we going to use strain? So coronary artery disease, as we mentioned before, because you might have a myocardial infarction and you might have dead muscle, but the muscles around that dead muscle is normal. So it's going to pull the dead muscle. And if you're just looking at it, it may have normal motion. But when you apply strain, right away you'll see that it's abnormal. Right away you'll see that it's abnormal. Resynchronization, and we'll discuss what resynchronization is. But roughly speaking, if the heart is dysynchronous, that is, different areas are contracting at different time, the heart is going to be inefficient as a pump. If somehow we could synchronize the contraction of the heart, then we could have a more effective heart as a pump. And we can use strain and strain rate to help us in that regard. Myocardial disease, and you're going to see some of these myocardial disease have specific strain pattern, and one of them is amyloidosis. Okay, so some of the heart disease have specific strain pattern. Once you look at the strain, you can say, oh, this is most likely this disease, heart disease. You can use it just as valvular heart disease and diastolic dysfunction as well. So what we're going to do now is we're going to look at some strain patterns and decide, you know, what we're dealing with. Okay,